your dentist needs to know. If you go to your dentist and you're diabetic, kindly feel free to share the information. It is not something that will make anybody discriminate you. It will just make sure that we are giving you the best quality of care. Hello guys, Dr. Candy here again, and welcome back to My Oral Health Diaries. Now we're in the month of March. We're looking forward to World Oral Health Day. There's so much that's going to be happening, but I'm sure we're going to discuss that next time. But look forward to it. This month is going to be exciting, not only on this channel, but just globally. There's that day on 20th March. Mark your calendars. Back to today's topic. Today we're going to be discussing a very important topic. We're going to be discussing the effects of diabetes on oral health. This is a very important topic because over time, it's like the prevalence of diabetes has really gone high. And from the survey that was done, or the estimates that were done by WHO in 2021, there was like 3.3% prevalence of diabetes in Kenya. And they estimated that to rise to about 4.5% by 2025. That's actually a really high number. And they said that 2/3 of the population is actually undiagnosed. So you can imagine if 4.5% have diabetes and 2/3 undiagnosed. So that's a very high number. So today we are going to be asking ourselves, what does diabetes, have to do with your oral health? Or when you're told you're diabetic, is there anything you have to worry about? Before we jump into the oral health segment of diabetes, we're just going to have a quick overview of what diabetes is. On this talk, I'm going to be using just the term diabetes to refer to diabetes mellitus because that's the most common one. The other one is not very common, so let's just focus on diabetes mellitus. So now there's normally like type 1, type 2, and other types of diabetes or hyperglycemia. That just means a lot of glucose that may be caused by other conditions in your body. So when you're told you're diabetic, that just means that you have a high level of glucose in your blood. So it's not controlled. Normally we say that at least it should not pass 11.1 millimoles per liter. That's like the maximum, even for like people who are on anti-diabetics or the diabetic drugs. We normally want it to be controlled below even like 8.9. So if you're diabetic, that just means there's a lot of glucose in your blood. So we ask ourselves, why is it bad to have glucose? And where is this glucose even coming from? So when we eat and the food is digested, starch, carbohydrates, sugar, those things, they're eventually digested into glucose. So then this glucose is absorbed into your blood. Then now that glucose is only useful to you if your cells can actually take it from the blood for them to transform it to either energy, if you need energy, and sometimes your cells may also transform it to maybe fats for storage. And what helps your cells do that? Insulin. So insulin in diabetes is normally the issue. So either you have a deficiency of insulin or your liver is producing too much glucose or you've become resistant to insulin. Most of the issues are basically surrounding insulin, but we've basically had an understanding of why insulin is important and what happens during diabetes. So the issue is normally mostly insulin. So we are having a lot of glucose in the blood and it causes a lot of complications. So why we are very concerned about the effect that diabetes could have on your oral health is the fact that periodontal disease or gum disease, as we most commonly call it, has been put as like a 6th complication of diabetes. So when you have diabetes, these things we are calling complications, it just means that if this level of glucose is not controlled, it may cause damage to other, vessels and to your nerves. And it may also alter or affect your wound healing. Like if you get a cut, the wound healing is going to be very slow. That's because of something that is called collagen that helps in the wound healing. So, all these things come into play and they basically make it very hard for you. So diabetes and periodontal disease kind of go hand in hand. When one is controlled, the other one gets better. So we basically want that the level of glucose in your blood is well monitored so that we are able to get good oral health for you. So I've just been focusing a lot on that, periodontal disease only, and I'm going to go deeper into that because that's the main issue. So another oral health effect you can have as a result of poorly controlled glucose in your blood is now patients who are diabetic can have a lot of incidences of dry mouth. So just the feeling that, there's either no saliva or you're just feeling like the mouth is dry. Then we normally encourage that such patients take a lot of sips of water. And then patients with diabetes also have an increased risk of decay sometimes. And that's just because, as we said, the level of glucose in the blood is higher. So in the same way, there's some fluids that are produced in the oral cavity that may as well come with a bit of higher content of glucose. And because of the dryness of the mouth, then the patient is also having an increased predisposition to decay. Another thing that patients will have, as I've talked about initially, is delayed wound healing. This also affects your oral cavity. So in case you have an extraction or a surgical procedure done in the clinic, then the healing time may be altered and it may be a bit longer because if that sugar is not controlled, then healing, it just goes haywire. Another thing diabetic patients may complain about in their oral cavity is something we call burning mouth syndrome. So that's basically just feeling like ni kama mdomo inawasha. That's, of course, as we've talked about, mostly because of the decreased saliva. And if a patient is diabetic, their sugar is not controlled and they're wearing dentures or any prostheses, then this burning mouth syndrome is also very common because of the plaque and the dirt that accumulates on the prostheses. As I had previously mentioned, periodontal disease is a very serious complication, as a result of diabetes. And I alluded to it before, but one of the most common reasons why periodontal disease is on this list of complications is because of something we've called collagen. So collagen is just something that kind of supports. Think about it as like a rubber band or like a trampoline, so the elastic thing. So teeth are basically supported in bone by these structures or these ligaments that are composed of this collagen. So if the collagen that you have supporting the teeth is altered with, then periodontal disease can happen, can destroy the teeth, the supporting structure faster because this collagen is not healthy collagen. Another reason why patients who have uncontrolled blood sugar are more predisposed to periodontitis is there's a theory or hypothesis that the type of bacteria that is present is a bit different. And it's a bit different in a negative way. So you have more aggressive bacteria or bacteria sasa zile mbaya. So they cause a kind of worse progression of disease as opposed to someone who doesn't have diabetes. The other thing is there are some cells that normally come and take part in mediating or kind of like being the what do I call them? Like the barriers or gatekeepers. They protect us from infections. These cells, their function is also altered if the glucose is not normal. So all these things come to play a big role in the progression of periodontal disease. We are not saying that just by the fact that you have periodontitis, just by the fact that you have diabetes, you're going to get all these things. But we are just calling them complications and trying to educate us on what are the possible effects of not managing systemic diseases such as diabetes. So those are the possible complications. Even if you have diabetes though, if you can manage to control it, you would not have risk of all these things. And of course, you need to be aware that these things could happen. So maybe today I'm just going to be educating us on what we need to be on the lookout for. So if you're diabetic and you're concerned and you've listened to this talk and you're wondering what can I do to make sure that my oral health is optimum, I think I can give a little pointers on what you should be on the lookout for. The first thing would be bleeding gums. Bleeding gums is not a good sign because essentially it's gingivitis or inflammation of the gum that would eventually progress to now what we have talked about, the periodontitis. So if you brush your teeth and you spit and you notice that there's blood in that, then that should be something that you should be concerned about. Visit a dentist to have a look. Another thing you should be on the lookout for is if your teeth change in the way they are like arranged. If you notice your teeth are moving, they are not the way they used to be, then that is also something that could indicate the presence of periodontal disease. So that's another thing. Another thing that you could also be on the lookout for is chronic bad breath, even after brushing. That could be, caused by just the diabetes. Sometimes patients with diabetes may have a very characteristic smell. It's like a fruity smell, kind of. Not very like nice fruity, but there's something there. So if you notice you brush your teeth, but there's still that smell that keeps lingering on, that's another thing you should be on the lookout for. There's something we call recession or receding of the gums. If you notice that your teeth are looking a tad bit longer than they normally are, then that may be a sign of recession, and you may need to have that looked at before it advances into something more severe. Also, if you notice that your teeth are a bit loose, that is also a warning sign. So you actually need to seek help when that happens. The sad thing is that for most patients, actually, when most studies were done, patients with diabetes, a lot of the times, were not getting regular dental checkup or dental visits. And I just wanted to raise awareness on the fact that, just having diabetes on its own is a risk factor with like your oral health. So you really need to be consistent with your checkup, get a dentist, and don't be scared to share this information with them, because your dentist needs to know. If you go to your dentist and you're diabetic, kindly feel free to share the information. It is not something that will make anybody discriminate you. It will just make sure that we are giving you the best quality of care. Thank you so much for joining us on this week's episode of My Oral Health Diaries. May have been a bit heavy, but I hope we learned something from it. And I'm really looking forward to the next episode. And if you guys have questions about diabetes and oral health, please feel free to ask on the comment section, and we will make sure that we respond. And thank you so much for subscribing, liking, sharing. Let's continue doing that, and let's continue learning more about oral health. We could actually make a huge, huge difference. I'll see you again next time on My Oral Health Diaries. Hello guys, should actually be, I'm sorry, Greg. Looking at me like, I'm nervous about this topic, man. Like, it's a serious issue. It's a serious issue. Okay, fine. Okay, I'm ready again. Okay, I've been ready 3 times. I'm ready. Sorry. So do you want me to start again?